Hi, I'm Dr. Howard Zucker with a Docology Diagnosis. The headline: the Centers for Disease Control rejected Milwaukee's emergency request for help investigating lead poisoning in schools, which is threatening thousands of children. Now, the reason: the lead paint experts at the CDC have just been laid off. The lead poisoning prevention and surveillance program has been closed. My diagnosis: concerning. And here's why. 1. This is just the tip of the iceberg. The first concrete example of the threat to America's health posed by random sweeping layoffs under DOGE and the new Health and Human Services Secretary, Robert F. Kennedy Jr. It will not be the last example, because experts across a range of specialties, not just lead poisoning, have been driven from the CDC. And next time, we could be helpless in the face of a salmonella outbreak, or contaminated pharmaceuticals, or an eruption of Ebola. 2, the core of the CDC's mission is working 24/7 to protect America's health. One of the most effective ways they have always done that is by dispatching emergency response teams wherever they are needed. In Milwaukee, a child was diagnosed with lead poisoning from paint in his school. More than 100 Milwaukee schools were built before lead-based paint was banned, so it's urgent that they be inspected. But the city doesn't have the manpower or the money to quickly identify and remove the risks. And that's where CDC is used, because they swoop in and help out, but not anymore. And then number 3, RFK Jr. has been forced to admit that closing the lead poisoning program was a mistake. And good for him for owning up to that. But he is not committed to reopening it. And for that matter, he hasn't said he would restore the capabilities he's reduced in food and drug inspection, virus hunting, HIV/AIDS treatment, maternal health, and much more. He estimates that 20% of his cuts were mistakes. Now, that might be okay in the world of software that the DOGE teams come from, but it's an unacceptably high failure rate when human lives are at stake, and we haven't heard a plan for fixing it. And that's my Docology Diagnosis. Subscribe at the link below so you can ask me anything, and join our full podcast episodes on YouTube and Substack.